A delta wave is a high-amplitude brain wave with a frequency of oscillation between 0 and 4 Hz. Delta waves, like other brain waves, are recorded with an electroencephalogram and are usually associated with the deep stage 3 of NREM sleep, also known as slow-wave sleep, and aid in characterizing the depth of sleep. Background and history: delta waves were first described in the early 1900s by W. Gray Walter, who improved upon Dr. Hans Berger's electroencephalograph machine to detect alpha and delta waves. Delta waves can be quantified using quantitative electroencephalography using freely available toolboxes, such as EEG-Lab or the Neurophysiological Biomarker Toolbox. Classification and features: delta waves, like all brain waves, can be detected by electroencephalography. Delta waves were originally defined as having a frequency between 1 to 4 Hz, although more recent classifications put the boundaries at between 0.5 and 2 Hz. They are the slowest and highest amplitude classically described brainwaves, although recent studies have described slower delta waves seen in sleep EEGs. Parasomnias which occur deep in NREM sleep also include sleep terrors and confusional arousals. Sleep deprivation total sleep deprivation has been shown to increase delta wave activity during sleep recovery, and has also been shown to increase hypersynchronous delta activity. Parkinson's disease sleep disturbances, as well as dementia, are common features of Parkinson's disease, and patients with this disease show disrupted brainwave activity. The drug rotagotine, developed for the treatment of Parkinson's disease, has been shown to increase delta power and slow-wave sleep. Delta wave-inducing peptide injected into the substantia nigra of the rat model has been shown to increase Parkinsonian symptoms. Schizophrenia people suffering schizophrenia have shown disrupted EEG patterns, and there is a close association of reduced delta waves during deep sleep and negative symptoms associated with schizophrenia. During slow-wave sleep, schizophrenics have been shown to have reduced delta wave activity, although delta waves have also been shown to be increased during waking hours in more severe forms of schizophrenia. A recent study has shown that the right frontal and central delta wave dominance, seen in healthy individuals, is absent in patients with schizophrenia. In addition, the negative correlation between delta wave activity and age is also not observed in those with schizophrenia. Diabetes and insulin resistance disruptions in slow-wave sleep have been shown to increase risk for development of type 2 diabetes, potentially due to disruptions in the growth hormone secreted by the pituitary. In addition, hypoglycemia occurring during sleep may also disrupt delta wave activity. Low-voltage irregular delta waves have also been found in the left temporal lobe of diabetic patients, at a rate of 56%. Fibromyalgia patients suffering from fibromyalgia often report unrefreshing sleep. A study conducted in 1975 by Moldovsky et al. Showed that the delta wave activity of these patients in stages 3 and 4 sleep were often interrupted by alpha waves. They later showed that depriving the body of delta wave sleep activity also induced musculoskeletal pain and fatigue. Alcoholism alcohol has been shown to decrease slow-wave sleep and delta power, while increasing stage 1 NREM incidence in both men and women. In long-term alcohol abuse, the influences of alcohol on sleep architecture and reductions in delta activity have been shown to persist even after long periods of abstinence. Temporal lobe epilepsy slow waves, including delta waves, are associated with seizure-like activity within the brain. W. Gray Walter was the first person to use delta waves from an EEG to locate brain tumors and lesions causing temporal lobe epilepsy. Neurofeedback has been suggested as a treatment for temporal lobe epilepsy, and theoretically acts to reduce inappropriate delta wave intrusion, although there has been limited clinical research in this area. Other disorders Other disorders frequently associated with disrupted delta wave activity include narcolepsy, depression, anxiety, severe urocompulsive disorder, attention deficit hyperactivity disorder and its 3 subtypes, juvenile chronic arthritis, consciousness and dreaming, Initially, dreaming was thought to only occur in rapid eye movement sleep, though it is now known that dreaming may also occur during slow-wave sleep. Delta waves and delta wave activity are marked, in most people, by an apparently unconscious state, and the loss of physical awareness as well as the iteration of information. Nevertheless, some people who practice a type of deep meditation called yoga nidra can remain conscious while in delta sleep. Delta wave activity has also been purported to aid in the formation of declarative and explicit memory formation. Cultural and religious role. In Advaita Vedanta, deep dreamless sleep is considered the highest state of consciousness. If one can stay aware or conscious while in deepest dreamless sleep, a deep meditative state is said to be achievable. This notion of paradoxical consciousness may be linked to high cortical activity which happens during the delta sleep. Pharmacology. While most drugs that affect sleep do so by stimulating sleep onset, or disrupting REM sleep, a number of chemicals and drugs have been shown to alter delta wave activity. Delta sleep-inducing peptide, as the name suggests, induces delta wave EEG activity. Alcohol reduces SWS delta wave activity, thereby restricting the release of growth hormone by the pituitary. The neuronal peptide, neuronal has been shown to increase delta wave activity during slow-wave sleep. The drug gabapentin, a drug used to control epileptic seizures, increases delta wave activity and slow-wave sleep in adults. While hypnotic drugs increase slow-wave sleep, they do not increase delta wave activity, and instead increase spindle activity during slow-wave sleep. Gamma-hydroxybutyrate increases delta slow-wave sleep as well as sleep-related growth hormone. Effects of diet. Diets very low in carbohydrates, such as a ketogenic diet, have been shown to increase the amount of delta activity and slow-wave sleep in healthy individuals. See also, delta sleep-inducing peptide, electroencephalography, K-complex, sensoromotor rhythm, slow-wave sleep, Wolff-Parkinson-White syndrome. Brain waves delta wave a euro, theta wave a euro, alpha wave a euro, mu wave a euro, SMR wave a euro, beta wave a euro, gamma wave a euro. References